All right. Good morning. Welcome to the town meeting program on KLAM, our local talk show, so we can talk about local stuff. And it's brought to you by Cordova Wireless Communications, which we really appreciate because we have been busy with this program of late in these pandemic times. Cordova Wireless Communications is your local cell phone provider, providing your local talk program. Great supporter of local radio, too. In fact, you could make the argument that without their help, we'd have a very difficult time doing what we do. And there is a lot to go over today, and it's important stuff. Sort of potentially kind of a tipping point in terms of how we move forward during these unusual times. And the bulk of that will unfold during a city council meeting today, the 13th, at noon, which you can view live on the city's YouTube channel. I find the easiest way to get there is to go to cityofcordova.net and then find that YouTube link. There are probably ways to search for it on YouTube as well, but that's what I have bookmarked. And we'll get into what they're going to cover on that, which is sort of the meat of today's program, in just a bit. I wanted to start, though, by going back to some guidance that we hope people will continue to follow in increasing numbers on the use of cloth face coverings, or, cloth masks, homemade masks. I think that the officials at federal, state, and local levels like to avoid the use of the word masks so it doesn't get confused with the commercial ones that need to be preserved for the medical personnel. So when you hear cloth face covering, that's what they're talking about, the ones that people make themselves. And by the way, a huge heroic tip of the hat for everybody who's got the sewing machines a-cranking and making those available. There are Facebook groups sharing information on where masks can be obtained by those who don't sew and need one. But the city is recommending the same thing that the state did with regard to masks. This happened a little while back, and it hasn't really changed, but I just thought it'd be good to go over again. Back on April 2nd, the state of Alaska announced a strong recommendation, not a mandate per se, but a strong recommendation regarding the use of cloth face covering. Scientific evidence available to date indicates that asymptomatic and pre-symptomatic shedding of the virus that causes COVID-19 is occurring. In other words, people that don't feel sick or look sick can be getting this virus on stuff by breathing it onto people or products or whatever. It can be coming off of you. You can be contagious even if you don't feel like you have it. So because of that, the state says this heightens the need, and really the CDC actually is where this comes from, heightens the need for community-wide implementation of control measures to prevent the spread of COVID-19 among people who are not experiencing symptoms of illness. The primary ways to do this are through social distancing, frequent hand washing, and disinfecting high-touch surfaces. Another tool that may help minimize transmission while people are around others outside their household is the use of face coverings. Because we're experiencing a nationwide shortage of medical supplies, including face masks, we recommend that Alaskans make their own face coverings and wear them in public settings where other social distancing measures are more difficult to maintain, like grocery stores or pharmacies, especially in areas of significant community-based transmission. Now, as a footnote to that, we don't have significant community-based transmission in Cordova, but why risk it? I mean, a lot of the medical personnel, including Dr. Zink, have said, when you go out, just assume that you have it and or other people have it and behave accordingly. If everybody assumes everybody is possibly contagious, that makes it a little easier in your head to remember to keep that distance. Now, there are other recommendations on how to use them, how to put them on, how to take them off to make them most effective. And if you want to get back into that, you can look at some of the documents. In fact, the most recent city news release, which came out on April 9th, news release number 17, which you can find at cityofcordova.net, has all of these details. That's what I'm reading from right here. But a thing that I like to add, and this is just an opinion, okay? This is not like official guidance, but I'm increasingly married to this idea, so if you'll bear with me. I think that mask use not only provides the preventative benefits, but I think you can also legitimately think of it as a way to show other people, hey, I recognize Cordovans are concerned about this, and I'm trying to do my part by masking up. If you have to be out, of course, the best thing to do is to not be out. Be home as much as possible, or if you're working in one of the essential industries. But anytime you're out and around, kind of regardless of how we all may personally feel about wearing masks, because it feels silly to some people. It's not something that we've done. A lot of people in the Orient do it all the time. They're totally used to it. It's not something Americans are accustomed to. So some feelings of awkwardness are certainly understandable and natural. I would hope that we could push past that, though. And like we've said on the show before, kind of think of this as, the 4th of July comes along, you put an American flag out. The holidays come along, you put up lights. We're all showing each other that we're kind of on the same page when we do things like that. Wearing a mask be a real good way to do something very, very similar to that. Even if you're not necessarily 100% on board with the medical aspect of it, which really you should be, because the doctors are the ones giving this guidance at the federal, state, and local levels. But, everybody has their opinions on that. I still think, though, that it's just a nice way. We put the iceworm banners up when it's the Iceworm Festival. We show some community unity there. And wearing a mask, I think, is a good way to do that. Now, again, it's not mandatory. And anybody who would shout at somebody who's not wearing one is being a jerk. So don't do that. Don't punish people for not doing something that is not required. If you want to provide supportive encouragement for them to do so, certainly do that. That's what a good community does. But don't stab anybody over it. That's bad. It's just a thought, though. Okay, moving on to the stuff that probably just about everybody who's been following this has been thinking about. There have been some pretty significant developments with regard to whether or not Cordova can restrict travel, mostly by air, but, through any port of entry, which would include the harbor and so forth. And I'm sure many of you know there has been vigorous debate on why that should or should not happen. And we're not going to get into the merits of the debate here because we like to just kind of stick to the facts. But certainly any of you who have a point of view on the merits of the debate should offer your testimony at the meeting that's coming up today, the 13th, at noon. Now, there's some important new information that's come to light that is going to very likely impact someone's testimony, which we want to share so we cut down on the number of people who don't know what's on the table and perhaps testify to wanting something to happen that can't. And we'll get into what that means. So taking a look at the agenda, there are 3 items. The one that I was sort of alluding to there is actually the second item. It's Emergency Ordinance 1186, and it reads thusly. An emergency ordinance of the Council of the City of Cordova, Alaska, imposing a temporary travel hold on all travel into the city of Cordova except travel by individuals seeking care at a Cordova Critical Access Hospital, first responders, police officers, and Office of Children's Services personnel from 12 a.m. April 15th through 11:59 p.m. April 29th to provide the city time to prepare for the COVID-19 outbreak. Now, that is something that quite a few people, I don't have a feel for whether it's a majority or not, but quite a few concerned people have been asking for this. I remember Luke Borer talked about it at a few council meetings back about, going through like May 1st, I think it was. Now, the interesting part about this, and this is, we're going to have to see how this plays out officially at the meeting, but what's happened since this emergency ordinance to have a travel hold went into the pipeline to get on an agenda, a set of state rules went through a pretty significant change. And this is why why knowing about this change at the state level is important going into today's council meeting. Again, not to suggest anybody should testify one way or the other, but just so you know everything that's on the table going into the testimony period. Originally, there was a document called the Alaska Small Community Emergency Travel Order. It's referred to as Attachment B. It's part of State Mandate 12 that had to do with traveling between communities within the state. Now, when Attachment B first came out, it had a specific definition of what a small community is. And that definition was an Alaskan community that's removed from the road system, has a population smaller than 3,000 as of the effective date of the order, and did not have what they called a hub hospital managed by the tribal healthcare system. That was the original definition. And what some people concerned about the influx of population into Cordova saw when they read that is that Cordova fit those criteria. Less than 3,000 people off the road system, don't have a hospital, a hub hospital managed by the tribal healthcare system. And so there was a push to have Cordova tighten up its restrictions on travel based on this Alaska Small Community Emergency Travel Order. And that has been a fairly prominent movement. Not unanimous, certainly. There's been considerable social media debate and debate at city council meetings and so forth, people going back and forth on whether this ought to happen, with some very strong arguments either way, in my opinion. So that's what it used to say. Now, what's changed, though, and we kind of saw this coming at the end of the last week when a question was put to the governor about whether Cordova qualified to activate this Alaska Small Community Emergency Travel Order. And Commissioner Crum and the governor verbally kind of hinted that Cordova didn't really because of having a critical access hospital. Now, that was kind of confusing because the original order said, as part of the tribal system. And that's probably because the idea for the original Alaska Small Community Emergency Travel Order, the idea for that, the genesis of that was actually in tiny villages in really, really way out there parts of the state that have virtually no infrastructure, not much in the way of stores, and absolutely squat in the way of medical care. But the way that they worded this emergency travel order originally, because of the reference to tribal healthcare systems, made it confusing because there were a number of communities very similar to Cordova that read that and said, well, we qualify under this. And there were elements in those communities concerned about the influx of population in the fishing season that wanted to be able to shut things, or tighten the reins a little bit. I'm guessing that as it became increasingly clear to the administration that maybe they had written the order in a way that didn't really reflect what they were trying to do or whatever. Maybe they were getting testimony from communities. I'm not sure. But for whatever reason, there has now been a very significant change to the Alaska Small Community Emergency Travel Order. It now says that in order to be classified as a small community and therefore to be able to impose the extra restrictions under the emergency travel order, a small community is removed from the road system, has a population smaller than 3,000 of the effective date of the order, and does not house a critical access hospital, sole community hospital, or acute care hospital. Now, for Cordova, that's a very significant change because this new wording significantly alters what people have been petitioning and asking the council to do in terms of invoking this. Now, there's a lot more information in the revised Alaska Small Community Emergency Travel Order in terms of what a small community can do in terms of restrictions and exceptions. I'm not actually going to go over them here because technically they aren't really relevant to Cordova anymore. Now, someone might want to make the argument that they should be, and you can take that to council and testify to that. So if you want to read it, and something else that's funny about this, well, not funny, but not like funny ha-ha, but it's been the new version was very difficult to find. I kept going to the link for this attachment B, that's the short name for Alaska Small Community Emergency Travel Order. I kept looking for the link for the updated attachment B, and it was always going to the old one. I spent hours, trying to find this new one. I finally found a clean copy of it that I was able to download from the government site. And I think it may have had to do with the fact that when we look for things on a smartphone or a computer, sometimes it caches a document. It stores an old version of it, and to save time, it'll just pull that old version up if the name hasn't changed. And I think that's what my phone and my computer were doing, although I tried to clean the cache and still couldn't make it work. But if you want to see the actual new order from the state government, I put a link to it on our Facebook pages for KLAM and KCDB, and actually I pushed it out to a number of the Cordova community groups, the Bulletin Board and Friends and Problem Solve and the Cordova, Alaska page. Kathy Renfelt shared it. So if you find that link that I put out there, that post that I put out there, and again, it's the one I can guarantee you is out there and easy to find is the one on either the KLAM or KCDV Facebook page. If you want to download this and take a look at it, you're welcome to do so. But again, the thing that's interesting as you read the new one is that while there are a couple of pages of small community travel restrictions and exceptions, that's what most of the document is, really none of that, according to this document now, none of that's really applicable to Cordova anymore because of the change in the definition to what a small community is. Again, when they say small community, it's not the way that a community perceives itself. It's not like a value judgment or an impression of how big a town is. It's a very specific definition. In order to be a small community and be able to impose extra travel restrictions and exceptions, you've got to be smaller than 3,000 as of the effective date of the order, removed from the road system, and not have a critical access hospital, which we have. Cordova Community Medical Center has a critical access hospital in it. Sole community hospital or acute care hospital. So that's really a game changer in this. And that's why reading this document, I think, is a good idea for anybody to do that's going to offer testimony at the council meeting. So you can speak to whether you agree or disagree, I guess, with this, and whether you think, for example, that the council should push the governor to change his mind again. That would be one possibility. Try and push the administration to change it back, or, there will be people, I'm sure, who think that the council should just do what it thinks it should do, regardless of what the governor says, which I don't think they can. But, again, we're talking about testimony, and people can testify to a thing however they want. So simply going by the documents, it seems like the city's Emergency Ordinance 1186 imposing a travel ban based on the state's permission for small communities to do so, they probably aren't going to be able to do that now. That's a guess based on reading the documents. But the purpose of public testimony is to share what you think. It would seem, though, that the city's hands are now tied. I don't think they have a choice, but that remains to be seen. So if you want to look at the agenda, and we'll go over what the other things on the agenda are. The agenda for today's meeting is at the city website, cityofcordova.net. If you want to review the revised Alaska Small Community Emergency Travel Order, I have tried still multiple times to download it from the state websites, and I can't get to it. So I don't know what it is, a technical issue or something weird with our computers or phones. But there is a clean official copy available through us if you go to the Facebook page for KLAM or KCDV, and you can download it and take a look at it. And Roman numeral 1 is the critical part. There's a bunch of stuff on it under Roman numeral 2, but as this reads, the stuff under Roman numeral 2 doesn't appear to apply to us anymore. Now, that potential travel hold is just one of the items on the city's agenda for today. Another one, Emergency Ordinance 1185, that's an ordinance of the City Council amending the code section on emergency mandates, which requires compliance with emergency mandates adopted by the city and imposes a fine for mandate violations. This is something that the city discovered it didn't use the right process to put in place, and they talked about this on Friday. In layman's terms, this is the ordinance that allows people to be fined for not complying with the emergency mandates, and giving the city the ability to make that action punitive. They got guidance from the attorney, I think. I'm not sure if it was the manager also, and maybe it was public feedback, but basically that they had inadvertently tried to put this ordinance on fines through using the wrong process. So they are correcting that. So that's why it's coming up. So you've got Ordinance 1185 on the imposition of fines for violating mandates. You'll be able to testify on that. You have Ordinance 1186, the travel hold, which again appears now to be a moot point because of the revised Alaska Small Community Travel Order. But, again, read it for yourself and decide. And then the other ordinance for today's meeting, Emergency Ordinance 1187, that's an emergency ordinance of the council ratifying revisions to temporary emergency rules and procedures adopted by the city manager in Emergency Order 2020-03 in response to COVID-19 that clarify the mutual aid agreement approval process. COVID-19 protocol submissions to the city, medical quarantine enforcement within the city, and collaboration efforts between the city and the native village of Eyak in response to COVID-19. And if you want to learn more about what that one means, you can look at the packet that accompanies this agenda. I'm not going to go through the whole packet here, but that information is there. You can download it from cityofcordova.net. Now, one other area of confusion here, again, because there are so many different, seemingly overlapping mandates about who's supposed to do what based on if they've traveled, if they're feeling sick, if they're not feeling sick, are they allowed to be outdoors, all of that. It's a big casserole of different possibilities. And, of course, like many other things, since we're living in sort of a new world here, has caused some confusion. And I thought it might be worth kind of trying to summarize that kind of in a descending order of severity. Because, bundled up within this bunch of mandates are rules about whether you can work if you're in an essential industry, whether you can go out and recreate in the great outdoors, whether you have to stay on your property and that's it. And I've been studying this stuff pretty intensively over the weekend, and I think you can boil down these categories to 3 groups of people and the accompanying rules or restrictions that apply to those 3 distinct groups. First of all, you have people who are symptomatic. They have symptoms of COVID-19, whether they've traveled or not. They are a sort of no matter what group, all by themselves. The rules that apply to them regardless of travel. The next group that you have are people that have traveled from out of state or out of country and have come into Cordova. There is a particular set of rules that apply to them. And then you have this third group that's people who have come into Cordova from in-state, say Homer, Wasilla, whatever. Their travel itinerary started in-state and ends in Cordova. So those are kind of the 3 groups. And if we take them in that order, you end up with a gradually less severe set of restrictions imposed by the state, and, as I understand it, are supposed to be mirrored by the city. So symptomatic people, whether they've traveled or not, whether they've been here the whole time or not. If you're symptomatic, that's one group. If you have traveled here from out of state, that's one group. If you traveled here from in-state, that's one group. So if you were going to write this down on a chart, you have symptomatic people, out-of-state travelers who are not symptomatic, in-state travelers who are not symptomatic. Now let's start with the most contained, the people that are supposed to be the most contained, the symptomatic people. If you are sick, if you have symptoms, the rule is that you quarantine at home and you don't leave your property for any reason other than to get essential medical care. So you wouldn't go to the grocery store, you wouldn't go to work. The whole thing about working in essential industry, if you're symptomatic, that doesn't apply to people who are actually sick. The only thing under the state rules, and again, I expect mirrored by the city rules, the only thing sick people can do is be home or to go get essential care. If you need supplies, you need to send somebody else to get them for you. And again, work, unfortunately, is not allowed if you're symptomatic with COVID-19. So that's the deal for people who have symptoms, whether they're local, whether they're from out of state, whether they're from in-state. Anybody who's symptomatic, those are the rules. Now, stepping it down one level to the out-of-state traveler who doesn't have symptoms. If you come to Cordova directly from Seattle or Oregon or Siberia or Timbuktu or pick a spot, any point of origin outside of Alaska. So you've got your plane ticket in Oregon and you're flying to Cordova. Cordova is your final destination. If you're coming into Cordova from out of state, the rule is mandatory 14-day quarantine. Very similar to what symptomatic people have to do, except that the out-of-state person without symptoms is allowed to work in one of the designated essential industries. That means you're allowed to leave your property to go to work, and to go home. But when you're not on the clock, as it were, and I mean, we got a lot of people who are self-employed that are sort of on the clock all the time. I'm one of those. I'm sort of not ever not working, but we never leave home. So we're lucky that where we work is right in the house. So people that don't have symptoms, that have come here from out of state, can leave home only for medical care or working in a designated essential industry. And that industry had better have their documented plan, which would include an individual, if you're a self-employed fisherman, as I hope you've heard by now, you've got to have a plan on file with the state and one of these mutual aid agreements with the city. So you've got to be working for someone who has a plan, or if you work for yourself, your plan for how you are going to do your job without harming other people with this virus, that plan's got to be on file. So, for example, if you are under these rules now, if you are a self-employed fisherman and your job is your boat and that's it, you need to have your plan on file with the state and the city before you start working. You don't want to go out there and be working as an essential worker and not be under a plan. And if you have questions about that, fishermen especially, CDFU knows about it, the city knows about it, and so forth. So back to this category now. This is our second category. The out-of-state traveler who doesn't have symptoms has to quarantine for 14 days, don't leave home except for essential medical care or working in an essential industry if you're doing so under a plan. Outdoor recreation for these people is not allowed. That's another important distinction and something that's been confusing. If you're coming to Cordova from out of state, you're not supposed to be out recreating, the whole great outdoors provision. You're not supposed to do that if you have come in from out of state. The only reason for an out-of-state traveler to leave home is medical care, working in essential industry, if there's a plan. Now, the third category, people who don't have symptoms and have just arrived in Cordova from an in-state location, Homer, Anchorage, Wasilla, Palmer, wherever. Someplace in Alaska, you come from there, that's where your ticket begins, and your ticket ends in Cordova. Those people are supposed to do a 14-day at-home quarantine, except for essential medical care, except for working in essential industry, if that industry has its plan on file, and the in-state people are allowed to be recreating outdoors, going on, the whole hiking, biking, hunting with social distance, of course, not in groups of multiple households. You've got to stay 6 feet away from anybody that doesn't live in your house. That's not, a member of your mostly immediate family. But so see, that's one more door open to the in-state traveler who doesn't have symptoms, is the whole outdoor recreation part. that's something that is okay, unless it changes, and things change very rapidly in this, but that's okay for people that come to Cordova from another place in the state. So you can see how, as we go from the symptomatic people to the out-of-state traveler to the in-state traveler, it adds a little bit more flexibility as you go. The quarantining is most severe for people who are sick, and that the only thing that you're supposed to do outside of your home or off your property. I mean, we really should clarify that for people that are not allowed to do the outdoor recreation part out in public areas or, that includes out the road and that kind of stuff. That doesn't mean you can't stick your head out the window or step out your front door or even walk around your yard, as long as you are absolutely sure that you can't get close enough to somebody to give them the virus. That's for the symptomatic people. That's also something that is expected of out-of-state travelers who are not symptomatic. You're not supposed to be out recreating just anywhere, but being on your property in your yard, yeah, obviously that's fine. So again, 3 different groups: people who are symptomatic, people who are not symptomatic but have traveled from out of state, people who are not symptomatic but have traveled from somewhere in the state. In that first group, the symptomatic people, you're supposed to stay home, period, except for getting emergency medical care. The out-of-state traveler stays home except for emergency medical care or doing an essential job, as defined by that list of essential jobs, and working under a plan. The third group, people that traveled here from in-state and don't have symptoms, still a 14-day quarantine. You can leave your property to get medical care. You can leave your property to do essential work, but then when you're done working and you clock out, go right back home. And you can leave your property for outdoor recreation as long as you maintain the social distance. So again, if you wrote this on a chart, you'd see one more thing be added as we go from the symptomatic group to the out-of-state travelers to the in-state travelers. It gets there's a little more available as you move through those groups in that order. Symptomatic people, it's very restrictive. Out-of-state travelers, almost exactly the same except for being able to work. People without symptoms that are in-state travelers, it adds the ability to do the outdoor recreation component. Now again, none of this is value judgment. This is what the rules say. This is the facts. And I'm sure people will continue to debate those and, decide whether they're going to follow the rules or not. It's worth pointing out these are all state rules. And if you are found to be in violation, there are some pretty stiff penalties. So for example, if you had come to Cordova from out of state and you are discovered doing anything outside your property except working in an essential industry, a designated essential industry, you would be in violation of the state mandate for out-of-state travelers, that's Mandate 10, and could be subject to a $25,000 fine and up to a year in jail. So they're not messing around in terms of trying to communicate the seriousness of this. This would be during your quarantine now, of course, in that example. Or another example would be if you traveled from somewhere in-state and were taking advantage of the opportunity to do outdoor recreation, but were found in close proximity to a bunch of people that are not in your household. Because remember, outdoor recreation, the only people that you can be close to are the people that are already in your household. If you're getting close to people that are not in your household, then there's the risk of people giving each other the virus. So in that scenario, say people from 2 or 3 different households said, oh, let's go do outdoor recreation, and they were all sitting super close to each other around a campfire or something. Can't do that. Not right now. Now, they're going to be reevaluating some of these things before too long, but right now, that would be something that people that traveled from in-state, so say, if you came from Anchorage, you're doing your quarantine, you get bored with it after 7 days, say, I want to see my friends, I'm allowed to outdoor recreate, and you and your friends from other households get together, you're asking for it, according to the rules. I don't mean to say, that the radio station is judging you for anything. Those are the facts. You decide what to do with them. We encourage people to follow the rules as a general course of action, so I don't know if that sounded like a bunch of babbling, but it's helped me understand this and answer questions that get asked of me in terms of, because people are asking me now on a regular basis, what am I allowed to do with this and this and this? And so I'm doing my best to answer them based on what these rules actually say. And those 3 groups are a good starting point, at least. Symptomatic people, very tight set of rules. People that travel here from out of state that don't have symptoms, a little more flexibility. People that travel here from in-state that don't have symptoms, a little more flexibility than that. So for what that's worth. And I think that's probably enough for today. Let me look here quick. I guess it's worth mentioning again for people in the fishing industry that the city's Commercial Fishing Task Force has been continuing to work on templates and even manuals, a draft procedures manual, a draft checklist for captains, handouts for crew education, a notice from the state of Alaska on using cloth masks during air travel. That's something else you're seeing a lot. Anybody on a plane is wearing a cloth mask, pretty much. The news release here says you can look at those documents at AMSEA's website, amsea.org, amc.org. So that'd be nice, because I don't think anybody wants anyone in the fishing industry to have to start from scratch or reinvent the wheel. There are a lot of really good minds in the industry coming together to try and make this as streamlined a process as possible to get everybody to where they have effective plans and procedures that they don't have to, create on their own. And any questions about that, by the way, again, CDFU is a good asset. I know UFA's got a lot of assets on their website as well. I think if it were me, I'd ask CDFU since it's the local folks. And then, of course, you can contact the city using that email address that they've been pushing, cordovaprepared@yahoo.com. That's the address that gets you right to the incident management team, and the answers come back from that team. And the incident management team is our core local people who are doing this stuff. So any of you in the fishing industry, and here again, if you've got people that you know that can benefit from hearing about this stuff, we'll archive this show, of course, on our YouTube channel. If you want to give them a link, they can listen to it. If you want to point them to the documents, if you want to tell your fishing friends who aren't here yet about the quarantine rules for in-state and out-of-state, about the assets that are available to them through AMC or through CDFU, I still very strongly believe that the best way to get everybody on the same page is if we reach out to the people we know who aren't here yet and tell them everything we possibly can regarding the facts of how to make this thing work. Whether you email your friends or you Facebook them or you call them, I'll give that example again. If you've got somebody who doesn't have a smartphone, if they just have a regular telephone, you want to do some good in their life, give them a call and read them some of these things if that's what it takes. Bring it up on your screen and read them the rules. So we get as many people out there aware of how to comply, which keeps them out of trouble, and more importantly, maximizes our chances of keeping people safe here. Because, for the bazillionth time, who are your friends more likely to listen to? A government official or somebody they know? Who are they more likely to trust? Who are they more likely to understand if you're giving them good information and recommending that they look at the documents on the city site and on the state site? So we'll end on that thought. And thank you for joining us for the Town Meeting Talk Show for April 13th. Remember, the City Council meeting today is at noon. And again, my opinion, I think it's sort of a tipping point type meeting. I'm definitely going to be paying attention. Their meeting is at noon. If you want to participate, you'll want to use the city's YouTube channel. And a reminder again, if you're going to call in and offer testimony, realize that what you hear on YouTube could be 30 seconds, 67 seconds, even 90 seconds behind where they actually are in the room live. I've heard people calling in, and they'll go to a person on the phone and say, "You're next," and that person is listening to the computer instead of listening to the phone, and you hear, talk coming from their computer that was like a minute ago. So if you're going to call in, doesn't mean you can't listen on your computer, but you've got to keep an ear on your phone, because the cue for when you're supposed to talk is going to come through the phone, not through your computer. And as soon as they call on you, mute your computer so the sound of all that previous audio that's a minute or a minute and a half old is not flowing through your phone while you're trying to talk to the council. So keep those things in mind if you're going to call in. Listen for your cue on your phone and mute your computer when they call on you. Town Meeting brought to you by Cordova Wireless Communications. We are proud to have them as a sponsor, very appreciative of that. And we will get this show on the YouTube channel, the one Robbie made for us, the Cordova TV channel. That is youtube.com/Cordova TV. Everything that we have done, all of our COVID-19 stuff, talk shows, mayor briefings, FAQs with the incident management team, and the special council meetings and the press briefings. We're putting those on our channel as well. So if you want to point somebody to this show to listen to it, you can share the link from our Cordova TV YouTube channel. The documents, like I've said, are on the state site and the local site. Definitely share those around. Inform your friends and family. That's the most powerful thing, I think, that you can do, in addition to participating with the council at the meeting today. Thank you again, Cordova Wireless, for the sponsorship. We'll make up any missed programming that was missed, and we will see you next time that it's time to do a town meeting talk show on KLAM. By golly.